Plants Will Save Us is a podcast by the Beneficial Plant Research Association, a nonprofit organization that researches plants to benefit human and planetary life. Plants are keystone species of culture and biodiversity preservation. Here we explore the ways in which we can, as a species, use them for medicine, food, culture, and clothing. Because without plants, we do not exist. Plants will save us. Hello, welcome back to Plants Will Save Us. I am Laura Ash, and I'm so excited to talk with Belinda Tan today. Thank you for joining us, Belinda. Dr. Belinda Tan is a physician scientist and technology entrepreneur. She's a co-founder and co-CEO of People Science, a transformative human research platform that is bridging the evidence gap in complementary and integrative medicine, food as medicine, health and wellness. Previously, she co-founded the pioneering global decentralized clinical trials leader Science 37, a technology platform that transformed the drug development ecosystem. She is a member of the Lundquist Institute and has served as an investigator in FDA registrational trials as well as investigator-initiated studies in dermatology. She is board certified in dermatology and dermatopathology and earned her PhD studying human innate immunity. She's a continuing student of life, a wife, mother, daughter, and sister. In between her professional endeavors, she indulges in simple local activities with her beloved family, which are gorgeous, and community in Venice Beach. Belinda is on the board of directors of BPRA, and we are so excited to talk to her today. Thank you, Belinda. It's so lovely to see you again, and I'm just beyond grateful for our relationship of this many years to be able to work together with BPRA and other work, which we can talk about later. And something that you've shared with me in our time knowing one another is about your heritage being brought up in Malaysia. And I would love to have you start with that today and share with us what you've shared with me is how much that's impacted your experience with health and maybe even the relationship you have with plants today.
Thank you, Laura. This is such an honor to be in this conversation and to be part of BPRA. My origin is from Malaysia. I was born there in the Malaysian Chinese community of many generations. And I came to the U.S. when I was 4. My parents had decided to move here for economic reasons and more opportunities for their children, as people do. And what emerged from that was a growing up. And at the time, I spent most of my grade school, middle school, high school years in the San Francisco Bay Area. And we grew up with a lot of traditional Chinese medicine, I guess Chinese herbs in general. And because we lived where we did, we had access to San Francisco Chinatown and Oakland Chinatown, where we would go on weekends to go and buy herbs that my mom had recipes for. We go to one particular shop in San Francisco Chinatown owned by Mr. Lim. And Mr. Lim would get the recipe from my mom, and behind him was a wall of wooden drawers that he would open and pull out these beautiful, colorful, and strange plants and things that look like antlers, animal parts. It was all very unusual to me, and weigh them on just in that old-fashioned scale where he'd move the weight and weigh them, and then he'd wrap each in a package of paper, and that was like one recipe. And my mom would take that home and cook it with bones. And we grew up with this in our diet as soup. We would have this as, what it was part of our life. And then also she would include different bitter teas that were, just concoctions that she would boil. And now I'm learning the term decoction. Decoctions that we would drink for too much heat. In the summer, here's what we take for too much heat. Or like chrysanthemum tea with rock sugar. And I didn't really realize how different this was until I left to go to college. And I was like, wow, I have no access to any of this at all. I'm essentially on this journey back home where a lot of what's coming up for me as all the ways that I show up in life as a mother, as a friend, as a community member, as a business owner and builder is that plants are calling me back, and they are asking me to put my professional efforts, being trained as a physician, as a scientist, as a technologist, into allowing for plants to be part of all of our lives. And fortunately, I'm deeply curious about it. That's probably one of my core traits is I'm just a deeply curious person. I've had the opportunity to pull up my mom's Chinese herb books and actually look at recipes and buy some of these plants. And I've been making it for my children. It's been really beautiful to bring this back into my life.
Thank you so much for walking us through that visual of going to the Chinese apothecaries, because I worked in an apothecary, and it was such a shocking experience for me when I first started working that I actually got to be the person weighing the herbs, and this was a Western herbal apothecary, so but similar enough to those amazing Chinese apothecaries that you see in Chinatown. And I love that that was your upbringing, because we know how rare that is, being modern humans in this world, that not very many children have that experience in the United States, at least. And for us to be able to share that with our own children is actually quite special. I'm curious how all of this journey has pointed you towards the direction of founding People Science. I'm very curious from your time at Science 37, how that transition to People Science was part of your own, like you say, coming back to home, coming back to the plants, part of that journey.
A huge part of my professional pathway, as many of you know who know me as a person, as a business associate colleague, is my partner, Noah. Noah and I have known each other for many, many years. We met at UCLA when we were both in the MD PhD program. We were friends within a program of many, many students, and became romantic about 14 years or plus ago now. Both of us are deeply curious people, and being with a partner like him, I was able to show up and explore and go back to what I was wanting to know more about my health, myself, the herbs that I grew up with, which I can't find anywhere in urban Los Angeles unless I go out to Monterey Park, which is just a wonderful repository of Eastern Asia. When we started Science 37, because we were both dermatologists, we were both scientists, PhD scientists, we had also both had a few years of experience building a telemedicine platform with another dear friend of ours. His name is Dave Wong with Director. We were the right people at the right place at the right time. When Genentech, Roche, and their innovation team wanted to make the experience of conducting a phase 3 rare disease trial a better experience for participants. So the Science 37 story emerged when Roche gave us a contract to build technology to innovate in that rare disease trial. And that's how that company emerged, and that's how two dermatologists launched what eventually became that global pioneering company in decentralized clinical trials. How do we then apply the learnings from that to something that is more deeply personal? It was automatically, it's plants, it's psychedelic medicines, it's plant medicines, non-psychoactive, it's alternative medicines, complementary, integrative, everything that kind of falls in between the traditional prescription paths of physicians. The part of me that loves to do things that are hard and people say can't be done was really excited about this possibility of working in an ecosystem where, coming out of the institutions of allopathic medicine, your patients who walk into the door with their list of supplements are not the people that you're trained to really feel comfortable with. So they give you your list, you walk out the room and you're like, oh my gosh, I have no idea what any of these are. What do I do? That feeling is what is also really compelling for me. It's like, I would love to be in the shoes of those physicians and providers and practitioners who are deeply wanting to help the patient that's on the other side of the door, and give them something in their hands to say, like, I understand you. Let's figure this out together. So People Science is a platform built to enable the research, the evidence generation, what works, what's safe, and to put that evidence into knowledge that practitioners consumers, patients, caregivers, anyone in the community who wants to seek different ways of making themselves better. It's built for that future.
People science, I'm learning so much about it, and it's really amazing, and can't wait to collaborate with you more. And we've got the tremendous honor of having you as on our board of BPRA, the Beneficial Plant Research Association. And I would love to know maybe how that transpired and, what being a part of that board and how that fits with this path that you've described.
I am one of millions of stories that can be a part of the voice of what contributes to VPRA. And I view myself as an archetype, of people in our communities who can show up and be part of an organization where our voice can be put into how do we all participate and contribute into this knowledge that needs to be modernized, because we can't go back to how we all lived decades or centuries ago. This is where we are today. This is our modern matrix, if you will. So where do the plans and traditional knowledge fit into it? So the BPRA mission and vision is incredible. And I think for me also as an entrepreneur and someone who loves to build and someone who loves to think about shifting systems, this is the form of organization and the people who are represented on the board, yourself, Dave, yourself, Laura, Traci. I am in awe at the synergies of all the relationships as well, in how this organization has started to stitch together and the momentum. I consider myself somewhat of a newbie. I come from drug development, academic research, and kind of hardcore materialistic science, if you will. That's almost the yang. The yin of me, my cultural background. I want that to all come into what so much has been already happening, in terms of botany, ethnobotany, and the many of the people on the board where they've come from. There's an organization you may be aware of that's emerging called the Global Alliance for Integrative Health and Medicine. And that is a vision for bringing together all the stakeholders globally from the different institutions and really being the energy of the Mother Earth, as I like to think of it. It's a holistic way of seeing how we can pull together all the voices across cultures into what our institutions have been set up to try to do. And yet there's a connective tissue, there's a spirit, there's a heart that is somewhat missing. And I think that's where plants and ancestral traditional use comes into play.
I'm curious, how do plants play a role in your personal life and in your health?
In the last few years, I would say, thanks to exposures to people who were collaborating with clients, partners, new friends who are coming into my life because of people science, I'm relearning about plants in a way to bring it back into my life as for health. So for example, broccoli. We were talking to one of the incredible scientists behind that, Jed, and I went down the rabbit hole of listening to some podcasts of his and jumped onto Amazon, bought myself broccoli seeds, bought myself a great way to sprout, and now I'm sprouting broccoli sprouts, and that's part of my life day to day. It's like I throw anything on it and it's like my green food. I'd mentioned with my mom, I'd pulled out her Chinese herb recipes, and I was looking at one in particular, a tea that I make quite often, and it turns out it's a tea I think for women's health. It's a liver tonic to reduce heat. And you make a decoction with Frutex ably and brown dates. And I make this pretty regularly for myself, and I can see this coming into my life more, rather than picking up like fizzy water, rather than that or anything else, I'll make this tea and I'll have it in the refrigerator. In Venice, we have a beautiful backyard where we're able to grow things and just tinker, garden. Garden is in and of itself just this beautiful experience. And in my future of rewirement, as some people like to call it, gardening will be much more of my time. What we do is we're starting to experiment more with growing vegetables from seed and, showing my children and reminding myself and Noah of this is the journey of what nature is presenting to you, and watching that growth and bringing that energy into our bodies, I think is how I view the experience that younger generations, I hope and wish more of them have that, so that it can transform how we can all see that plants are the key to so much nourishment for our souls, our bodies, our spirits. Yeah.
We've also been talking a lot about participatory research, and it's such a big term. And we'd love to learn a little bit more for our audience about what people science does do. And I know that you also do decentralized clinical trials. So, how does that all fit together?
Much of how we conduct traditional clinical trials, for drug development academically, is there's a main investigator, there's a main researcher, a main scientist, academician who comes up with the idea, designs the study, and that's kind of the center top-down approach of how we derive evidence. And even when we built our platform at Science 37 around decentralized clinical trials, where it was already a huge innovation to enable people to participate from the home and local community, that was huge. What still continued to be missing, in my opinion, was this valuing of you must continue to pay attention to the participant, the research subject, as some people might call them, the patient, the person who is contributing the data into the evidence. You must continue to pay attention to them because they will determine the quality of the data. They will be the ones who decide whether or not they want to stay in the study or not. And it's critical. And so how we've thought about that with people science is we've built our technology tool that's essentially a data management platform to always be centered around participation, so that we could maximize the ability for data to be collected in a high quality way, have minimum attrition, meaning people don't drop out very easily, have minimum missing data, and allow for doing research in the way that we would all want research to be done. Participatory research, in my view, is looking at research from a bottom-up versus a top-down approach. And what I mean by that is that everyone involved at scale in a study, so these are the participants, the subjects, they're the ones who are involved in the actual research itself in terms of design, in terms of decision-making about, what's important, what's not, all of those aspects of it. And the details of, are they determining the endpoints, outcomes, statistical analysis, that can be figured out later. It's the notion and the spirit of everyone has come to the table to think about it and plan it together. And that's what makes it participatory. Some people may think about it as, well, it could be research where only subjective outcome measures are collected, and that's one form of it. Some people have probably heard the term citizen science, and I would say citizen science is a way of putting a lens into what the potential of participatory research can do, which is bringing in the voices of the people who are actually contributing the data and asking the questions and benefiting from the results and the outcomes. So coming back to people science, we've built our platform to enable participatory science. More broadly speaking, human research, whether or not it's a traditional clinical trial that's very experimental, protocol-driven, randomized double-blind control, all the way to purely observational, subjective outcome measures, longitudinal, and involving a lot more input from participants.
So excited you're talking about this because there's so many questions, not necessarily in the physician, well, maybe with the physicians as well, or integrative physicians, on the value of participatory research versus the value of human clinical trials. But you and I, with Land of Verse, with People Science, did two participatory research trials together, one on skullcap 2 years ago, and then the second one on dandelion root. And that process of working with you was really important for me, but also I think more important for the participants to learn about their own health in the process, to learn about how to actually ask the right questions for their own health and well-being, to gauge how they feel today versus yesterday and be able to watch that and track that for themselves. So the part of participatory research that I really love is that empowerment with the individual, in addition to the data you can collect afterwards, which is what percentage of people are feeling the same as the individual, and all of that is shared. And I'm really excited to dive deeper with you in the future, which we will have future podcasts about doing work with you and more research with you and people science with BPRA and the individual plants. Because as we know, there's just not enough data, really good modern research with participatory research and human clinical trials on individual plants, which is one of the biggest, most important keystones for BPRA is whole plant research, which Dr. Andrew Weil is very passionate about and has spoken about for many, many years, and really the why behind BPRA getting started again.
It's also bringing to mind for me the power of how we can reframe thinking about research, collecting data, evidence generation is in this way of participatory research and, broadly speaking, scaled research that is more naturalistic, real world, and still rigorous. I think that's a really important part of all of this, is it's still rigorous, and the rigor is built into the automations in the technology to allow for that, as well as the processes around, how one conducts a study. The path is clear now, I believe, for science to make a lot of our research personalized. And in what you're describing, Laura, in those studies with dandelion and skullcap, it was like a cohort of N of 1. And that's another compelling offering and quality of how this research is being conducted, how the tool is being built for people in integrative medicine and functional medicine is like, oh, finally, all the different variables can be included, into the data set, and we can learn from that. It doesn't have to be as experimental and limited. Leroy Hood had put forth the framework of P4 medicine quite a while back. And in P4, he talks about personalization, prevention, prediction, and participatory. And that's so important to acknowledge that, because I think that only up until now, I guess, this past decade, and I'm somewhat living in my bubble, admittedly, having built the platform at our last company, and now I feel like we're here. We can do this because the tools are here. The smartphones are in everybody's hands. The wearables are only getting better. We are learning a lot, and the time is really now to get this done.
For those people listening that don't understand what N of 1 means, do you mind sharing what that means when it comes to research? Because this was new for me when we started a couple of years ago, of understanding the terms of traditional research.
With traditional research versus N of 1, let's start with traditional research. So in traditional research, if you'll think about it as conventional cohort-based experimental research, a cohort is, say, 100 people get randomized to placebo, 100 people get randomized to treatment. And so the results of that, when you look at it statistically, it's comparing these two groups of, what is statistically significant between these two groups. And so you generalize, but you're not very specific. So, Belinda is one of the people in the placebo group, and overall placebo was 30%, but intervention was 60% improvement. I can't say that I improved 30%. It was the general outcome of that group. It wasn't me. What's different about N of 1 is that you're looking, Belinda and the 99 other people who are in this N of 1 study, we would each go along in our own journey, submitting and collecting data over time of placebo versus intervention. And there's some nuances that I won't get into, but it's like there's washout periods, et cetera. But putting that aside, what N of 1 allows for is to really understand, did it work for me or not? So in that ideal study, I get randomized to my placebo time period, my treatment time period. There's a crossover. And over time, as I'm following along in this journey of the experiment, I can start to build confidence that this is really working for me or not, because it's me within the study. And when one does the biostatistical analysis, and by the way, I'm not a biostatistician. I learned this from the stats folks on our team. Um, Powering a study where you can compare the effect of Belinda before and the Belinda after, it's a more powerful way to power a study rather than in those large cohorts. And that's why in these sorts of N of 1 studies, if you can collect the study data with an appropriate amount of time, you can have smaller sample sizes and it's still a highly powered study.
Thank you very much. As some people would argue that N of 1 is just, as you've been saying, is so much more powerful and important to all of us. Because, my patients in my clinical practice sometimes wonder the news they hear about clinical trials or meta-analyses, like how it's relevant to them. But to do an N of 1 or to do some of the participatory research that Laura set up with you, Belinda, I mean, that is strikingly powerful. And for fear of breaking some confidentiality agreement that I signed, like having done the skullcap one that you alluded to, like just doing the ratings, like I thought about things in a different way. And it kind of brought to my mind, oh, I wonder how my sleep is or how is my mood today? And kind of really got me involved. It was pretty exciting.
When one educates himself just a little bit more, one can embark in that scientific process. And there's a quote that I love from Carl Sagan, where he states that every single person is born a natural scientist, and something in our societies and modern day somehow pushes that out of our life. So I feel like we all have that innate ability. And when we have the tools that are easy to use, it almost sparks joy, does it not, Dave, in your experience? I do a lot of my own N of 1. Noah will attest to that. And I'm always testing something, and it's really fun.
I love that. And in fact, because science, and we need that more than ever right now, given the bad name in some circles that science has had, and I'd love for more people to get involved with testing and trial and maybe a little error here and there. And we've often discussed in our kind of BPRA cohort about how we really want everyone to be their own ethnobotanist, like have people interact with plants and delve into their own backgrounds. And I think everyone can be their own scientist, their own ethnobotanist, their own ethnomedicine experimenter of sorts. So, and kind of on that vein of thinking about science and trends and what's out there in the world, we are curious to hear what you think about maybe conditions or demographics in our communities that you are most interested in studying.
Broadly speaking, I feel like the global health challenges that we're seeing is around metabolic health. It's likely one of the major outcomes of globalization and our culture of what we have shared, in foods, of lifestyles and technology. And within that, it's obesity and type 2 diabetes. There's so much that then impacts our mental health and our mental well-being. So how one categorizes that. If I wanted to even expand beyond, and this is where I've been inviting in curiosity of other frameworks of thinking about health, the spirituality and how one thinks about the impact of our lack of spirituality, which then impacts our mental health. And I know in some cultures, and particularly Chinese medicine too, it's so fascinating. The frameworks are so different. We're so organ-based in allopathic medicine or Western medicine, and we're pathogenesis-based and pharmacologic in terms of our intervention. And to be able to step out of that and have the humility, to think about how this all works differently. This whole organism, whatever my skin is holding on to and all, it can work differently depending on how you think about the how and what framework. If I have to kind of stay in my lane, as a Western professional with a platform like People Science, and how can we do good things for planetary health and for humanity, I would say those are the areas that I'm most interested in is mental health and metabolic health.
So one of our questions that we ask on every podcast to all of our guests is, how do you think plants will save us?
among BPRA's priorities, like education, to invite people into appreciating the simplicity of plants, and also that it could be any plant. It could be the pot that you get from the grocery store, for the holidays, or any simple plant, to simply spend time with it and nurture it. That simplicity is going to give us so much more lessons than we can even describe. And so I could be outside gardening and time passes. I feel like I've had a yoga session or something that has really nurtured me, my body and my mind. So whatever plants are doing, they're doing a great job. And I believe that because they're so simple and so accessible, that is a major advantage of how and why plants will save us.
Thank you so much for all of your everything today, sharing about your personal story, about your professional journey, and giving me a lot to think about. I need to go and garden right now based on everything you shared. I am so grateful to be able to work with you with Landerverse, but specifically with BPRA. And I am excited about our future collaborations and work, which is to be coming. So all of you will hear about it. But I'm just really grateful for who you are in the world, and what I am honored to be part of is your authentic path and your inner journey, coming out into a professional career, coming out into an opportunity for many people to hear, which I believe is inspiring for everyone to know that purpose and passion and professionalism, it is possible, and you're really doing it. So thank you so much for sharing that with us today.
Thank you, Laura. Thank you, Traci. Thank you, Dave. This has been a beautiful conversation.
Plants Will Save Us is a podcast produced by Laura Ash, Traci Pantuso, and David Kiefer. To find out more about the Beneficial Plant Research Association, visit bpra.org. Thank you so much. We will see you next time.